This Thursday is World Bipolar Day, meant to help bring awareness to the disorders and eliminate the stigma. But what exactly is bipolar disorder and how does it affect those who have it? Joining us now is licensed clinical psychologist and UNK psychology professor Krista Fritzen. Thank you for being with us today.
Thanks, Colleen, and Beacon Behavioral Health Education Center in Nebraska appreciates you bringing awareness to our communities on behavioral and mental health.
We are so happy to be able to do that. Now, this coming up Thursday, it is World Bipolar Day. Can we start off just by defining what exactly bipolar disorder is?
This is a severe mental health condition that's diagnosable, and it's basically where an individual experiences classic depressive symptoms like significant changes in appetite, energy, motivation, sadness, possibly suicidal ideas, inability to kind of get out of bed, maybe more social isolation, and inability to function. But then they also have the added component of episodes of excessive, exaggerated energy levels where they can't sleep and don't need sleep. They don't need to have maybe 3 hours of sleep and still function very well, but have really exaggerated energy levels that sometimes can lead to high impulsivity, irrational thinking they can accomplish things that are really impossible to accomplish, and can become very devastating and destructive because their belief system becomes very distorted in their ability to accomplish tasks and impulsivity.
Do we know what causes this?
Most of the research supports that there is a genetic component, so there's some biological factors that play a major role. So if you have family members, the closer the family member, the more likely you could develop it, but usually it's a combination of that genetic predisposition or kind of vulnerable to developing it, and then major stressors, life events that can occur that lead to the development of the disorder. And by no means, if a person has a family history of bipolar disorder, does that mean they're automatically going to develop bipolar disorder? They just have an increased risk, much like diabetes or asthma, those kinds of disorders.
We're actually running out of time. I do want to talk about treatment and hope if someone is diagnosed with bipolar disorder.
There is hope. We have very good treatments, usually a combination of medications as well as psychotherapy, where you can work and treat the family, the behaviors, the emotions, along with the medication. Medical piece is typically the evidence-based treatment.
Okay, Dr. Krista Fritzen joining us, and we will see you next week. Thank you, as always.
Thank you.